Facial spasms can be a huge problem for patients. Not only are they socially very bothersome and distracting, they can also have a huge functional impairment, because if you feel like you can't keep your eyes open to perform your activities of daily living like reading and driving, that has a hugely negative impact on your quality of life. Benign essential blepharospasm, or BEB, and hemifacial spasm are the two most common types of facial spasm that oculoplastic surgeons tend to see. Benign essential blepharospasm is a bilateral condition that involves the upper face. So these patients present with difficulties opening their eyelids or keeping their eyelids open. There is this overwhelming spasm that wants to close them down. This tends to occur in patients who are over the age of 60, and it's thought to be due to an age-related degeneration or change in a part of the brain referred to as the basal ganglia. Now, hemifacial spasm is a little bit different. These patients can be a little bit younger than those with benign essential blepharospasm, and this tends to be a unilateral condition. But instead of just involving the upper face, it tends to involve the entire side of the face, involving the mouth, oftentimes the mentalis or the chin, and the muscles around the eye. Now, this is an important distinction to identify what type of facial spasm is going on, because those with benign essential blepharospasm don't require any investigation. But patients with a new diagnosis of hemifacial spasm should have some neuroimaging performed. Now, the reason for this is because involving the one side of the face can be related to irritation of the seventh cranial nerve. Now, sometimes this is from a blood vessel. We call this a docoloectatic vessel. And that doesn't necessarily need to have anything done about it, though in cases that are refractory to some of the botulinum toxin treatments we'll talk about in a minute, you can consider referring them to neurosurgery for a procedure where they put a sponge between the vessel and the nerve. But really the important part of getting an MRI for someone who has a new diagnosis of hemifacial spasm is to rule out a more concerning issue like a tumor compressing or irritating the facial nerve. Now, once the MRI is done and everything is clear, the two conditions are treated fairly similarly. What we do is we use neurotoxin, Botox would be a common brand name for this, to inject into the muscles that are having this abnormal spastic connection. Now, what botulinum toxin or Botox does is it prevents release of the chemical that is important in communicating the signal from the nerve to the muscle to contract, right? So by preventing the release of this chemical, you have weakening of the muscle, and that means that it can't spasm and close down the eyes or create a noticeable twitch of the lower face as easily. Botox injections generally take about 3 days to start acting. So if you have spasm, you can expect that it will continue at the same severity and frequency at least in that first few days. And usually by about 2 weeks after injection, the medication is at its maximal effect. So if you're being injected for the first time, somewhere around that 2-week mark is a great time to come back in so that we can evaluate if you needed a little bit more here or a little bit less there and plan to adjust the treatment pattern for the next visit. Now, Botox usually lasts for about 3 months. Of course, there can be some individual variation. I have patients who require injection every 8 weeks, and some people who only come to see me twice a year. So it can be variable. Really, the key in these conditions is to let the symptoms guide you. If your spasm is not bothersome, you don't need to do anything about it. But if it's starting to impact your quality of life, then it's probably time for your next injection. In terms of the side effects of botulinum toxin injection, most of them really relate to local side effects. So of course, as you can imagine, every time you do an injection, you insert a needle through the skin, you can develop a small bruise. Usually these bruises are small and they go away within a couple of days, but I would say that's one of the main side effects to be aware of. The other side effect is really related to the mechanism of action of the drug, right? We said that it makes the muscles less strong. Well, it can make the muscles too weak in some cases, and that can cause drooping of the lower eyelid or drooping of the upper eyelid. And if you're injecting in the lower face for hemifacial spasm, you might notice that your smile feels asymmetric or you're having difficulty making some finer movements with your lips, like sucking through a straw. Usually I'm very conservative with my botulinum toxin dose in the lower face because those problems are really annoying for patients. But the good news is that even if you develop one of these unintended consequences from botulinum toxin, it's temporary because it will wear off just like the therapeutic effect wears off in somewhere around 3 to 3.5 months.